Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a great guest today. So looking forward for this conversation is Ann Richter. And so Diane was an immersed in the world of natural and integrative medicine, thanks to her time spent at her grandmother's health food stores in the Atlanta area. It was there, surrounded by natural remedies and vibrant discussions on wellness, that Diane developed a deep appreciation for integrative methods of a balanced approach to health. This early exposure ignited her interest in a comprehensive approach to health, leading her to pursue a career in nursing. So she became a registered nurse and dedicated many years to working as a surgical trauma nurse on a level 1 trauma hospital. However, her commitment to integrative health remained unwavering and led to pursue a career that incorporated her interest in natural medicine. So nearly a decade ago, she joined Breast Cancer Conqueror as a seven essential system that health coach, as a health coach, where she strategically and passionately supports women through their healing journeys. Diane now works as the head coach as she is in a unique position to combine her extensive clinical experience and natural medicine background with the holistic and integrative philosophies of the seven essential system. True breast recovery requires more than just a treatment plan, it's a lifestyle change. And Diane is unique position to support each woman, helping them navigate their health and breast cancer healing with a balanced, thoughtful, and informed approach. So thank you, Diane, for being here with me today. I really appreciate it.
Yeah, thank you for having me. I'm excited to be here.
Yes. So tell me a little bit about your journey in integrative health. It started at a young age. You say, as I mentioned before, with your grandmother health food stores. How did it shape you in supporting women to breast cancer today? What was that correlation there?
Yeah, my grandmother, I have very fond memories of her health food store. She had two health food stores in Georgia. And so as a young girl, I mean, I always joked that it was child labor, quote unquote, jokingly. But she would have me come with her and I'd help her stock the shelves, and I remember the first day she let me try kombucha and I thought it was so cool that I was drinking something bubbly and I would help her with the cash register. So as a young girl, I worked in that store and then I decided to become a nurse. And while I was going through nursing school, my part-time job to support myself through nursing school was working at her health food stores. So I always joke that I kind of had like a dual education. I was going through nursing school, and unfortunately, going through nursing school, we only had one presentation about integrative care, 1 hour presentation in the entire 4 years I spent in nursing school about herbs and supplements and food and how they can correlate with disease process. And most of that presentation was focused on drug interactions, right? So it wasn't even really educating you on the benefit of them. So, that was one area that I was getting educated in. And then at the very same time, I'd go to nursing school and I'd leave my classes. I'd go to my grandmother's health food store and I would work there. And then the people who came into the store were educating me about what they were buying and why they were buying it and what benefit they had had from using these herbs and supplements. So yeah, getting kind of taught at the same time by both areas, one through the people, who were doing it themselves and the other through nursing school, all through my career as a nurse. I loved integrative medicine for myself personally. There's a time and place for medicine, but there's also a time and place for herbs and food and supplements. So getting to finally kind of focus in on that integrative a little bit more by working for Breast Cancer Conqueror was a big dream of mine. That happened about 10 years ago. Time flies. Can't believe I've been doing it that long.
Yes.
But 10 years ago, I began working with Dr. V to be a health coach.
Okay, if you want to tell us a little bit about who is Dr. V and why this breast conquer, whole thing start developing.
Yeah, absolutely. So Dr. V, she started off as a doctor of chiropractic, and she had her own breast cancer healing journey. So she tells the story as, one day she was in the shower and bam, she felt that lump. And she has always said that she just kind of knew immediately when she felt it. This is not a normal bump. This is something different. So Dr. V was able to go through her breast cancer healing journey completely natural. She didn't use any traditional medicines on her personal journey. Of course, that's not the right course for everyone, but that worked for her. And so based off of that experience, she put together what she calls her seven essentials system, which is what we work based off of. It's the seven things that she kind of followed through her healing journey. And interestingly as well, just to finish out Dr. V's story, she did have a reoccurrence of breast cancer. So she's now gone through it twice.
Wow.
Similar thing, she once again just felt a lump, something was there, and bam, here it is again. And so her story of that is, of course, that was shocking and difficult to go through, but it allowed her to fine tune those seven essentials, find the pieces of the puzzle that were maybe missing, and even update some things. As we get into habits, some things fall off that we might want to keep up. She was able to kind of ramp herself back up and update those seven essentials a second time.
Oh, wow. And she recovered for her second time with no any other traditional treatments. Wow.
She did. It took her years. It's not a quick thing. It was multiple years that she worked on it, but she was able to heal a second time completely natural. Yeah.
Wow, I'm so excited to look about this. So, what is this seven essential system and how do you use this to guide a woman on a healing journey?
Yeah. What's funny is if you go on Google or whatever and you search natural cancer healing, you're gonna get, 100 pages of information, right? There's so much stuff out there. And so that's what I really like about these seven essentials. It kind of narrows it down to step-by-step pieces, things that you need to address. So the first of the seven essentials is to let food be your medicine. We know food can be very foundational for our health. There's lots of studies that show the kinds of foods you eat can increase or decrease mortality rates with breast cancer. So what foods do you eat to help support yourself? The second of the seven is to reduce your toxic exposure. I love the name of that one. We live in a toxic world, so you're never going to be able to eliminate your toxic exposure. It's impossible, but there are ways you can work on to reduce your exposure and then also to detoxify when needed. Essential number three is to balance your energy. So this is looking at hormone balancing. It's looking at chiropractic care, acupuncture, lymphatic movement. I know you're a physical therapist, so moving and exercising and getting your body moving in the right way. Essential number four is to heal your emotional wounds. That's a essential that is oftentimes not addressed in traditional medicine. They're not really focused on those emotional things. They're serving a different purpose, right? But it's important to address those emotional wounds. Cancer is a very emotional disease, and there's a lot of ties to stress and stress management and emotional traumas to women who have breast cancer. Number five is embrace biological dentistry. Your mouth is the gateway to your body, so you've got to keep that mouth clean. There's some modern dental techniques like using metals in the mouth that may actually increase the incidence of breast cancer. So making sure you're using the appropriate dental cleaning methods and different dental techniques. Essential number six is where the supplements and herbs come in. So using therapeutic plants and herbs. And then the final essential is essential number seven. That one is early detection and testing. So that's different tests that you can use, blood work or even urine saliva testing you can use to kind of monitor how your body is doing through a healing journey.
Wait, that's excellent. What kind of, if we go back into your early detection and testing, you want to tell me a little bit about that testing?
Sure. Yeah. So we like to look at tests that are preventative. The current gold standard for diagnosis of breast cancer is mammography, and there's pros and cons to that kind of scanning. One of the biggest cons in my mind is that it is not preventative at all. We're not looking at something that's showing early signs of cancer development. Mammography is only going to show a problem once it's already there, right? So if we can start incorporating some preventative testing, if you catch something early before it's actually caused a problem, you can maybe adjust and change before it does create a problem.
Mhm.
So some of my favorite early preventative tests, one is thermography. So thermography uses an infrared camera. It takes pictures of the body. There's no pressing or squeezing or radiation. And what it's looking for is blood supply and inflammation in the breast tissue. So
Mhm.
our breasts should really be pretty cool and clean. There shouldn't be a lot of blood supply in them. If there's inflammation in one of the breasts, then you can work to decrease inflammation. That's an early sign of some issues that may lead to cancer development. Vitamin D is another big one. Most of us are very deficient in vitamin D. Even getting out in the sun, we don't get as much vitamin D from our sun anymore like we used to. So most of us need to supplement. So keeping your vitamin D levels nice and high is important. Iodine is another one. Our breast tissue really thrives when we have enough iodine. And again, we're not getting a lot of iodine in our food sources anymore. So testing your iodine levels and supplementing if needed to keep them nice and high. Hormone balance, that's a big one, right? So we live in a toxic world. One of the biggest toxins that we are exposed to are chemical estrogens. There's a lot of chemical estrogens out there. Thinking about parabens and phthalates and BPAs and plastics, right? We're surrounded by it. So checking in on how your body is processing your hormones with an estrogen methylation test is also helpful. One of my favorites is the Dutch test. You can order it on your own. You don't need a doctor, and it tells you how you're methylizing your hormones. And then finally, checking in on inflammation a little bit closer. So using some inflammatory markers. And these are blood work that you can have done, very simple. There's 4 of them I like to recommend. The highly sensitive C-reactive protein, the lactase dehydrogenase, the erythrocyte sedimentation rate, and homocysteine. Those are what we like to call the trifecta of all labs. They're like the best of all the labs. Those are some really highly sensitive inflammatory markers. Once again, looking to make sure we're keeping inflammation down because high inflammatory markers, inflammation increases risk of cancer development.
Great. So if I have, again, my primary care is a traditional physician, right? And if I go to him and say, hey, I would like for you to order this lab work, then like how is he gonna do that? Like he will know, like, okay, yeah, I'll do it, but what are you like? I'm already, like I say, doing this podcast and listening to other functional medicine podcasts. I already kind of start going into, I need you to look into all these thyroid levels on me, and I need you to do this. And like, why are you listening to it? What are you reading? So I'm like, no, you should listen to this and you should listen. And he listens, and he, I think I kind of get him a little inspired to look into other options besides the traditional medicine. But then how do you, a lot of people who does this, right? I mean, in a hospital environment where it's traditional medicine. And then when you start talking to a lot of, people about these tests, they're like, oh, how do I get those tests? Is my doctor gonna know what to order? Is my insurance is gonna cover for this? So what is your advice on that?
Some of these tests are actually things you don't need a doctor to order. So, for example, iodine testing, vitamin D testing, you can do at home. Thermography, you don't need a doctor to order. You just find someone who offers thermography. I think the only one you would need a doctor to order for you would potentially be the inflammatory markers I talked about. But it's interesting, I haven't had a lot of clients have pushback from their doctors ordering these. Doctors are aware of what these are. These are very common blood markers. In traditional medicine, they may use them for a different purpose. A lot of them are used for detecting heart issues like chronic heart inflammation. So they may use it for a different purpose, but they know what they are. And so my clients going in just simply will say, hey, these are inflammatory markers. They know they're inflammatory markers. I'd like to check in on my inflammation. And a lot of doctors are willing to do that and understand the basics enough of them to order it.
Okay. All right. Excellent. That's very good. So many are interested in prevention of breast cancer. And what would you say are some of the most important? Oh, we kind of already talked about prevention. We already kind of went into that question without even knowing what's happening. How about what is your advice that you will give someone that is newly diagnosed with breast cancer?
Yeah, that's a really good question. Cancer is a scary word. And getting a diagnosis of cancer can be really, really scary. And typically, the way it works when you get diagnosed is the belt moves really fast, so to speak. So you get your diagnosis very quickly. You're meeting with oncologists, you're meeting with surgeons, you're meeting with radiation oncologists. They have you moving through that treatment plan very quickly. So, my advice to women when they first get diagnosed is to just take a moment to just calm down, to relax. Because you have choice. You can kind of think about what you think the right route is. And again, different people choose different ways of healing. Traditional medicine has a time and place. A lot of women I'm working with are choosing to use chemotherapy and radiation and surgery. But even if you take a moment before you start those things and give yourself some space, you can make a game plan on how you're going to support your body the best through those treatments. So, don't wait forever, of course, but don't feel like you have to make a decision the same day you get your diagnosis about what you're going to do, because these are treatment plans that may influence you for the rest of your life.
Mhm.
Take a nice big deep breath, go home, think about it, talk with your family, do your research, and then figure out what the best path is for you, what the best combination of treatments is for you. Don't feel like you have to make a quick decision.
I like that. I really like that because you're right. Sometimes it's like we have a breast cancer diagnosis, boom, you're in the surgery consult, and then your surgery 2 weeks later, and then you're in radiation 4 weeks later, and then, so it's just, do you really have to be happening? But I think it's just, you'll be afraid that if I don't take care of that now, it's going to grow on me, right? And we have seen cases actually where we have patients who, for some reason or other, delayed their condition to be treated, and then this actually multiply because it's more aggressive type of cancers and they just move fast. But it is a hard decision to make at that point. But I like that. I like the idea to, pause it a little bit and search, and don't always go for a one opinion, go for a second opinion if you're not really convinced of this is what you need.
Yeah.
Because it's important. Yep, yep.
Yeah, again, you don't want to wait too long. I'm not saying to wait forever, but in the scheme of things, taking a week, you
Yeah,
know,
yeah.
taking 7 days or 2 weeks even maybe, that's not going to make a big difference. So you have enough time to at least take a couple of days, take a week to do your research and to make sure you're like you said, get multiple opinions, ask your oncologist questions about what they're recommending. A lot of my clients will say to me, I had my chemo surgery radiation before I even knew like what to expect with it. You just get pushed so fast through it.
Mhm.
So yeah, definitely don't put your head in the sand and don't do anything, but you do have a week to go home and think about it. You have some time to take a deep breath and to get your mentality ready for what you're going to do.
Okay, that sounds like a very good advice. So Breast Cancer Conqueror emphasized the importance of stress management. Why is that, and what are some of the best ways to manage this stress? Because it's easy to say, yeah, you just wait and you just go through all this, but wait until you're in somebody's shoes who actually have the cancer, right? So I'm sure I have not been on those shoes, thank God, but this is who I deal with every day, right? This is people who just been with cancer, one or the other, breast cancer or any other kind of cancer. So I can see how that can be so stressful not to think about it and take it easy, right? So what is a good ways to manage that?
Yeah, stress management is really important on a breast cancer healing journey. And actually, stress itself, even prior to breast cancer diagnosis, stress can be a factor that can increase your risk of cancer development. So I always say stress is the most potent carcinogen you can be exposed to. And that's after saying just a few minutes ago that we live in a very toxic world, right? So knowing that we live in a toxic world, I still feel like stress is the most potent carcinogen you can be exposed to. And just to back that up, there's a couple of studies I always like to share. There was a study done in 2016, and they found that women with unmanaged anxiety and stress had a 2 times or were 2 times more likely to develop breast cancer than women who managed their stress. And then in 2001, women who underwent stressors but did not have any emotional support to manage those emotional stressors had a ninefold increase in the risk of breast cancer.
That's
So yeah, if you read an article that said this substance would give you a ninefold increased risk of breast cancer, you would avoid that substance at all costs, right? But
yeah.
here, stress can do that. It's a very potent carcinogen. So, and then as you mentioned, you get your breast cancer diagnosis. That is very stressful on its own. But what I like to remind people about these studies is what they're finding is not necessarily just being exposed to stress increases risk of cancer. It's not managing stress. That's the key. So management, stress management is really important. So some of my favorite ways to manage stress, I always tell my clients, you need to check in on yourself and your stress levels multiple times a day because all of our days are different. We go through different, experiences every day. If you need to set an alarm on your phone for 4 times a day, a little alarm goes off and you take a step back from what you're doing. You check in with yourself. You see if you need to use some type of a modality to manage your stress. And then if you do some of my favorite modalities, there's a kind of meditation work called heart mathing or heart math, heart variability work. And what this is based off of is that our heart organ actually sends very calming parasympathetic or sympathetic nervous system mode reactions up to our brain. Our heart communicates more to our brain than our brain does to our heart. So if you can practice calming your heart down and getting your heart really calm, that sends that calm signal to your brain. That helps you stay in that parasympathetic calm nervous system mode. So again, that's called heart variability. You can look at Heart Math Institute. They actually have a sensor that you can wear on your shirt that measures how calm your heart is. And
Okay.
that gives you an opportunity to kind of practice, to kind of know what it feels like.
Okay.
Heart math.
Okay.
Another good resource is EFT tapping, known as emotional freedom technique. So this uses acupuncture points, and you're doing a gentle acupuncture tapping on those acupuncture points. And again, similar, what that's doing is that's sending a parasympathetic, calm, nervous reaction to your body. I always like to joke that it's telling your body, hey, I'm not being chased by someone with a knife. You do not have to be in fight or flight mode right now. I'm sitting at my desk. No one is chasing me. I'm not in risk of dying right now. You
I'm
can calm
safe.
down.
Yeah.
Exactly, you're safe. So you tap on these acupuncture points. They're on your face and on the side of your face. You can look up the EFT tapping points. And it's a combination of that gentle acupuncture, which is moving that energy and helping give that calm reaction to the body. But then you also kind of speak out loud what it is that's making you feel stressed, which verbalization really helps as well, you know? And then, of course, a big one that a lot of people are talking about right now is vagal nerve stimulation. So our vagal nerve is the longest cranial nerve in our body, and it is the switcher between our fight or flight response or our rest and digest response. So stimulating that vagal nerve can help get you into that rest digest response. So an intense way of doing that is cold water immersion. A lot of people are doing cold water baths. That's one way of doing it. I hate cold. I mentioned to you earlier, I live in Charleston, South Carolina. I live in a hot place usually. I'm not a fan of cold. So that was not one that I've mastered yet, but that's one way. A lot of people do find that helpful.
I do. I do.
You do? Okay, see, you're brave. So you'll have to give me some tips.
Yes.
But interestingly, our vagal nerve also runs very close to our vocal cords. So singing or humming, laughter, those things can also vibrate that vagal nerve. Maybe not as intense as cold water immersion, but it is a way to do it. So force yourself to sing a song that you like, sing out loud. Deep breathing exercises also calm that vagal nerve down. Massage is a great way to calm it down. You can't feel stressed during a massage, right? It's almost impossible. So massage. And then, of course, exercise. Exercise is really important. Exercise releases endorphins. It releases stress hormones. It helps our body process those stress hormones. High intensity interval training, if you can, is a great way for stimulating that vagal nerve.
Awesome. Oh, that's so awesome. We do something here where we help a lot of the patients who are about to go into chemo and radiation. So we like to bring them in and work with a HIT program prior to their chemotherapy or radiation. And I have seen some great effects. I didn't realize that that was a vagal system, like vagal nerve stimulation. I was doing it
Yep.
for, like kind of like helping with oxygen to just enhance more the chemotherapy and as well help a lot with some of those secondary effects, cancer-related fatigue. They just feel great, get stronger, and I have seen great results in like minimum secondary effects from chemo and radiation. So that is super interesting that's why it helps as well with just calm you down. I thought it was just more these endorphins, but it's all this vagal nerve stimulation. That's awesome to know.
That's
Great.
so great you're doing that. I mean, obviously there's endless benefits to exercise, right? Exercise is one of those things, and research with cancer agrees. People who exercise more, they have better mortality, better responses to their treatments. So exercise is very, very important. But yeah, one of the added benefits is it's vagal nerve stimulating. So it's actually calming you down and getting you in that rest and digest mode.
That's awesome to know. That's why I work out at lunchtime every day. So it can keep me calm down for the afternoon.
Perfect.
Um, so you've been the head cancer coach of Breast Cancer Conqueror for the nearly a decade. How
Mhm.
have you seen the landscape of breast cancer healing and prevention evolve during your time with Breast Cancer Conqueror?
Yeah. Um, there was a recent survey that was done in 2017, and that survey found that 73% of breast cancer patients are using complementary medicine, meaning they are doing chemotherapy, radiation, what their doctor suggests, but 73% of those people are also using food, supplements, vagal nerve stimulation, whatever it be, things we just discussed, complementary medicine alongside their treatments. So that's a huge shift, and I think it's a great shift. And I'm seeing it on both sides. I am seeing, doctors who originally seemed completely natural or really into the natural world now accepting, how chemotherapy and radiation and surgery can have its time and place in their cancer patient's journey, and vice versa. I'm seeing oncologists and radiation oncologists seeing the benefit of adding in some of these complementary medicine pieces. So I'm seeing this integrative piece coming together, and I think it's amazing. There's a balance in integrative care, that a lot of my clients are benefiting from.
That's excellent. So so we have integrative medicine and I really love the physician who we work on with integrative medicine, but I'm still feeling like, yes, integrative medicine, at least here, is more like, yes, she look into overall, like what other supplements you can have to keep your system, less inflammation. What can I support when you're going through chemotherapy, and then acupuncture and counseling and, meditation. But I don't see a lot of like for instance, I was kind of wondering, she should be the one ordering all this testing, right? To begin with, like what is my inflammatory markers happening, right? Because so I just don't see, I love that you start seeing that there. I don't see that here yet. Like it's nice that we have an integrative medicine, but I see that it's not a lot of things like, like we talk about fasting with chemotherapy and the great benefits of it. Like she's like, well, not necessarily, or maybe yes, maybe not. So I don't see that yet happening, at least here. So how can, like, is anything you can, like, any tip, like, how can I make that to happen, right? How can I create that integration more?
Well, it's going to happen anywhere you go. I think that that's the emphasis and the importance of a patient being their own advocate. We can't hold our doctors accountable and ask them to know everything, right? They can't know all of the options out there. So your doctor is always going to come to you with what they think is the best option for you within their knowledge, right? What they've been taught, what they've experienced. And so it does sometimes fall back on the patient to do a little bit of their own research, to look at other options, and then to bring those options to their doctor. I'm a big advocate for communication with your doctor. I don't think it's smart to ever hide anything that you're doing. I think your physician should always know what supplements you're taking and what you're doing. It's
Absolutely.
very important. But
Yeah.
that's where that communication comes in. So bring the studies to your doctor, bring the research to your doctor and say, hey, I'm going to fast with my chemo because of this study. I want to share this with you.
Mhm.
So yeah, it just takes sometimes doing your own research and being your own advocate. And certainly there are support programs out there. We do offer coaching as well. That's actually the point of what we do, is to make sure that women are educated about all of the options so that they can bring the things they think work well for them to their doctor. So maybe consider doing a coaching program so that you can make sure you're kind of looking at all of the options.
Okay, that's very good. Um, for women currently undergoing breast cancer treatment, how can you or how can the Breast Cancer Conquer coaching program complement conventional treatments to support overall well-being and recovery? So you just mentioned to be a coach. So how can they reach out to you, or how you can help them to help with that coaching that they don't find where they are?
Yeah, definitely. Yeah, we love to work with whatever a woman is doing. So that's our role. It's a little different than working with a doctor because a doctor is going to tell you this is what you should do. Your coach is going to say, here's all the options of what you could do. So we like to work with what you're doing. And so someone who comes to us who is working with their traditional doctor, we want to know what things they're suggesting, what treatments they're going to do, and we are going to find the things that help support your treatments for you the best. And then on top of that, all of us are different. My body works different than your body, works different than the next person's body, right? Our genetics are different. So we also do testing and we do different methods to kind of make sure we know what's going to work best for you as an individual person. So it's not a cookie cutter approach. It's individual to each person.
So you pretty much like, let's pretend you have somebody going through chemotherapy. So they continue going through their traditional chemotherapy, whatever medication dose the medical oncologist is recommend, and you're just supporting their body based on whatever testing, whatever they are at on their own and whatever treatments they're getting. Is that right?
Yeah, exactly. They'll share their lab results with us if they want to. We'll
Mhm.
talk about what those lab results mean because far too often your doctors don't get to spend enough time with you, right? They come in and they say maybe they have 5 minutes. So we make sure they understand what their lab results are meaning. We discuss kind of what their doctor suggestions are to them to make sure they understand that. And then, like I said, we'll make suggestions. If you're doing this particular whatever chemo it is, here's some supplements you could consider. Talk with your doctor about these supplements to make sure that he agrees. But here's some things you could do to support yourself while going through that treatment.
That's excellent. That's very good to know. As well with some of those secondary effects, like I have seen a lot of patients, the like chemotoxicity from neuropathy, induced chemoneuropathy, or like the, chemo brain or, fog brain and other, so many different things that happen with
Mhm.
that. So you feel like a lot of some of these supplements will help to mitigate some of those secondary effects as well.
Definitely. Yeah, we work with a lot of women who have some side effects from chemotherapy. But what's interesting is what I have found is people who are going into chemotherapy with an integrative approach, already doing things to build their body up, they don't have as intense or as severe side
That's
effects as what you hear sometimes. Yeah. So from the get-go, those side effects might be less severe, but when you do have, or if you have some of those side effects, there are definitely essential oils are great for neuropathy. Even peppermint oil on the areas that you're having the neuropathy, magnesium oil, those things can help with those side effects. So we will have certain suggestions, things they can consider if they do have more severe side effects from those treatments.
okay, very good. And then what would you advise, what would be your advice be to someone who wants to use integrative methods, but their oncologist isn't familiar for those approach?
Yeah, it goes back to kind of being your own patient advocate because again, you can't necessarily expect your physician to know everything because like we said earlier, if you Google cancer care, hundreds of things pop up. So there's lots of options out there. So again, you want to use integrative medicine, bring the studies, bring the research, bring your game plan to your oncologist. And, it does take having the courage to talk to your doctor. That can be scary sometimes. But just remember, your doctors are there to serve you. In my nursing career, I always tell this to people, doctors go into that field out of a good place. They want to help people. So your
Mhm.
doctor is there because they want to help you. So have the courage to talk to them and to say, I appreciate what piece of the puzzle you're bringing to my healing. I think it's really important. You play a big role in my healing, but I want to support myself with some natural things. And here are the natural things I'm going to do. And here's why. Here's the studies, and give it to them. So again, always communicate it with your doctor. Never hide anything from your doctor, but bring the research to them. And in that way, you may actually spread the love. Your doctor might learn something and might be something they suggest to a future patient.
Yeah, yeah, that's excellent. You mentioned something in the beginning with Dr. V about, well, you mentioned two things. One is food. So you have a lot of different, like, some people talks about you should just do a plain plant food regimen, right? And then you have, no, you need your protein, right? You go into all these diets, carnivore diet is great for you, anti-inflammatory. And then, no, you need to go into, yes, vegetables. So based on what you guys with your seven essentials, what have you find that is kind of a good mix of that when you're talking about, implement like what you eat when you put in your system?
That's such a great point. There are 1,000 diets, and there are stories from each diet of people who had benefits, right?
Mhm.
So we have a saying, we say there is no one size fits all diet. Unfortunately, there isn't a diet that we can just say everyone should eat this way and this is going to work for you because we are all so different. Our bodies are different, our genetics are different, our background and what our ancestors ate is different, right?
Mhm.
So test and don't guess when it comes to your diet. One thing you can test that's very important with cancer healing is blood sugar. So it is known that high sugar levels can feed cancer. So the lower you can keep those sugar levels, and I don't mean lower in terms of way too low, I mean the more balanced you can keep your sugar levels, the weaker those cancer cells are going to be. That's going to make your treatments even more effective, right? If you kick them while they're down. So testing your blood sugar at home, that's very simple. It's something, just like a diabetic would do. Check your blood sugar when you eat your meals and see if you're seeing spikes. And if you're seeing spikes, then maybe try to pay attention to what's causing those spikes for you. And then you might want to kind of minimize those things. Another form of testing is genetic testing, epigenetic testing. There's a test called the nutrition genome. It's a little cheek swab, very easy to do. You don't need a doctor to order it for you. And that cheek swab, they'll map out your genetics and tell you the things your DNA is really, really good at, but then also the things your DNA needs some support with. And then they'll tell you what nutrients support your DNA the best. So they'll actually give you a quote unquote grocery list. It's a genetic grocery list. These are the foods that have the most benefit for your genes, your DNA. So that can really help narrow it down to give your DNA better function as well. So yeah, test, don't guess. There is no one size fits all. Just test and see what works best for you.
That's excellent. 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 And what is your, so you were mentioning with Dr. V that when she went through her second bout of breast cancer, she was trying to in tune some of the seven essentials. Will you give us a little tip on like what did she make better or what did she find out that worked better the second time?
Yeah, sure. The blood sugar testing was a big one for her. So she, in her first healing journey, she implemented a lot of juicing and smoothies. She did very well with that in her first healing journey. But on her second healing journey, she wasn't feeling great when she was juicing. She wasn't sure why. She started testing her sugars. She was having blood spikes. So for whatever reason, she had changed, and the juicing was kind of spiking her sugar too much. So blood sugar testing was a big one that she fine-tuned to try to fine-tune her diet and find the right balance for her. A big one for her also was stress management, what we just talked about. She was working a lot, she was taking care of a lot of patients, and she realized I've kind of let this go too far. I need to hone in and really kind of make some space for myself. She's also implemented a testing called RGCC testing, which is a blood test. It's a blood test that looks for circulating cancer stem cells. So some people call it a liquid biopsy, so to speak.
Oh,
Not
yeah.
to mean that it's yeah. So it's not meant to be a diagnostic test. That's not how you use it, but it is looking for those circulating cells in the blood, and the number of them does give you an idea of kind of, if it's really high, you need to bring that down a little bit. So she implemented that kind of testing as well in her second healing journey.
Okay. Yes, I have heard some of that liquid biopsy testing as well.
Yeah.
That's excellent. What are you guys thinking about mammograms? What is your or Dr. V or your, advice on mammograms? As a,
Yeah,
go for it.
sorry. Yeah, again, there's a time and a place for everything. So I think balance is always key. So I'm never the type of person to say never have a mammogram, right? I think it's important that someone makes a decision for themselves on what is important for them. With that being said, there are some known cons to mammography that you would want to weigh those pros and cons. The pros is that mammography is the gold standard thing used right now for, diagnosis of breast cancer to start that wheel starting. But the cons are there's radiation involved, and that radiation is being put directly into your breast tissue. And the type of radiation used is a low energy radiation. And
Mhm.
that low energy radiation can actually cause DNA damage. So there is a lot of research that shows that the overuse of mammography can actually increase your breast cancer risk down the line. So that's
Mhm.
something just to pay attention to. And then another issue is the squeezing. There's, a lot of doctors who feel like that intense squeezing on a tumor may actually break a natural encapsulation and potentially release some of those cells into the blood, increasing the chance of metastasis. So again, time and place for everything, but there are certainly some cons. So it's important to kind of weigh those pros and cons for each person. If I have a client who's wanting to try to avoid mammography, what I'll suggest them doing is just talking with their physician. Oftentimes, if you have a mammography that shows something suspicious, the physician is next going to say, let's do a follow-up ultrasound to verify. So maybe just ask your doctor if you want to avoid mammography, would you be willing to do the ultrasound first? Can we do the ultrasound first? And if the ultrasound shows something suspicious, then I'll talk to you and I'll decide if I think I want to do the mammography next. So
Okay.
that's a potential to just have that discussion with your doctor to see if they're willing to switch up the order a little bit.
Got you. Got you. Yeah, because I do mammographies every year. So once a year, I'm getting exposed to it. I have a dense breast, so it's kind of
Mhm.
like, okay,
Mhm.
so one point like when did you make that decision? I don't radiate or I don't do it, and then what happened if I don't do it 1 year, right? And you just go by palpation. You just go by. It's kind of like, it's scary to just kind of like, okay, what else do I do?
Yeah, I would never just go by palpation. You always want to have some form of physical screening involved. It is interesting to note, though, that mammography is known to not be as effective on dense breast tissue. So dense breast tissue is an interesting thing that, mammography oftentimes isn't as effective for screening dense breast tissue. So you could have a discussion with your doctor if there's an alternative. Some people will do MRIs because you're at least avoiding that squeeze and that low energy radiation into the breast tissue. And also ultrasound. Again, ultrasound's another good one because it is physical screening, and it's still physically looking into the breast tissue, going beyond just physical palpation.
Okay, yeah, so maybe an ultrasound, and if everything is good, then we good. If not, then going into a mammogram. But if the mammogram doesn't show a lot of things on the dense tissue, then it's like, do I really want to do this versus just jump into an MRI? But then unfortunately, goes insurance, right? Is the insurance going to cover for MRIs, right? This is just, again, the other thing. It's just really, I mean, a lot of our patients who had breast cancer, sometimes we hear the insurance don't want to pay for an MRI, so it's depending how the physician coded if the insurance is going to end up paying for that. So it's like, man, it's just really everything goes evolving around insurance. It's ridiculous. So.
It's true. Insurance is a big piece of it. And that is, again, another big piece of the deciding factor for a lot of my clients is, resources. Your money is resource. So sometimes you're kind of stuck in the system and you have to follow that route, but it's always worth at least having the discussion with your doctor to see if it's something they think would be okay for you to do something a little different and if they can code it differently for you.
Got you. How about how can people find you? And I'll have those information on the show notes, but how can they find you?
Yeah, absolutely. So our website is breastcancerconqueror.com. So you can find us there. You can also reach out to me directly. My email is coaching@breastcancerconqueror.com. It's a lot of typing, but that's how you can reach out to me if you're interested to learn more.
Great. And then so they just reach out to you, and then you just pretty much establish with them a coaching appointment or whatever takes place. And then how often do you see patients? Like, do you coach patients depending on the patient, or how that works?
Yeah, so what we do is we sell programs, so a coaching program. So one that we will sell coming up is that we have some group programs about 4 or 5 times a year. We host a group program. It's a 10-week group program. So once a week, we get together on Zoom as a group. We discuss each of the 7 essentials in detail, and we kind of teach people kind of how to implement them. That's more of a group setting. If someone wants something a little bit more one-on-one, then we do offer one-on-one coaching. So those are 6-month programs. So it's 6 months and it comes with 6 hours of coaching. So you can use those hours kind of what works for you, but it's at least an hour a month. Also, email support, of course, is all included in that as well. So yeah, if someone is really want to get details about the coaching programs, we have someone who works with me named Ginger. Her email is support@breastcancerconqueror.com. And she can really in detail explain the difference between the coaching programs, what might work for one person versus another. Some people's needs are more and they want more, they may want more one-on-one time, whereas other people are like, I'm happy just to learn in a group, so you can decide what would work for you.
That's excellent. Well, that has been wonderful. What a great information. I really, really appreciate. Thank you for being willing to do this with me. Please tell Dr. V thank you as well for all the work that she's doing out there. I'm listening to some of that's how I think she was interviewing by, I don't know, it was Dr. Simmons or somebody else on one of the podcasts. And I was like, oh my God. And then I just start following her. That's how I end up kind of like reaching out to you guys. So thank you for all the information that you guys are putting out there. It's great.
Thank you for having me, Durley. I really appreciate it.
Absolutely. You have a great evening.
You too.
Bye.